I'm Dr. Dan from Vitamin Pro, and we're talking about a gluten-free diet and when to start it. And this is part 2, so please look at part 1, so I don't have to repeat too much of that, because you know how these time things go with these short videos. But I want to go to point number 2, and the celiac experts, of course, say that you shouldn't start these gluten-free diets without a diagnosis. And you wonder how much time these guys have spent the last 10 years looking through the literature to see what kind of things have been written. Now, there are over 60 documented disorders associated with gluten, and these are documented in the scientific literature, and a lot of these are life-threatening. And some examples would be, juvenile onset diabetes, adult onset diabetes, rheumatoid arthritis, multiple sclerosis, osteoporosis, which, believe it or not, kills more women than anything else over 60. It's not heart disease or cancer, it's osteoporosis. Dementia, autism, cerebellar ataxia, and if you haven't heard of that, I'm glad, but if you know what I'm talking about, you know how bad that is. Thyroid problems, liver problems, gastric reflux, and many others. Now, with all these things that I just mentioned, if there were some other substance in our culture that was causing all these problems, let's say aloe vera. Let's say that all of these were associated with aloe vera. What do you think would happen to your supply of aloe vera in the health food store? Well, it would disappear in a very short time, right? But these things are documented, okay? This isn't some fringe opinion. So, recommending that a person stay on wheat and similar grains, except for this specific narrow diagnostic category, is just wrong, knowing that how destructive wheat can be to people. So again, either these experts are sincere but badly mistaken, or they're somehow getting some of their compensation from the wheat industry. I'm not sure which is which, but you gotta wonder. Okay, let's go to this other study that was done in about 2002, and basically it showed that celiac disease. Well, let me back up just a little bit. One researcher wanted to know, what is a true rate of celiac disease? Now that we know how to test it with tissue transglutaminase and biopsies, in fact, he's probably the one who figured out the nice correlation. But they tested about 13,000 normal people throughout North America, and guess what they found? That 1 in every 133 people has celiac disease, as demonstrated by biopsies and or this tissue transglutaminase antibody, which is very specific for celiac disease. So that's a huge number, but let's go a little bit farther. Guess how many of these are actually diagnosed? And if you guessed not very many, you were right. The answer is 4. Out of every 133 people in North America with celiac disease, 4 of them are diagnosed. So that's not a very good rate. It's about the misdiagnosis rate is about 97%. So if you're going to wait for some magic doctor to tell you you've got celiac disease, knowing that the misdiagnosis rate is 97%, how long are you going to wait to get a good diagnosis? So also, most people who have celiac disease do not have any symptomatology. In fact, only about 1 in 8 or 1 in 9 of the celiac patients have what we would call typical intestinal celiac symptoms. So that contributes to the misdiagnosis, because the way you diagnose celiac disease isn't by just looking at intestines, it's looking at the whole picture and looking for things like lupus and rheumatoid arthritis and MS and that kind of thing. So that's another reason why you shouldn't wait, because the diagnosis rate is so terrible that your chances of getting a good diagnosis are not very good. So that's part 2. And we'll continue on part 3 on the next video.